Good afternoon. This is Dr. Mike Attilio, the Vice President of the Mohawk Valley Health System Medical Group, here to talk to you very briefly about what our medical group is doing to help keep you healthy and safe during the coronavirus pandemic. As you may have seen in the news, our state has issued requirements for our healthcare systems to make sure we are prepared for a potentially huge surge in the number of patients who are admitted to our hospitals. In order for us to help make sure that our providers, nurses, and other clinical staff are in a position to do that, we are now creating plans to close some of our ambulatory or outpatient clinic locations. I need to reassure everyone as we do this that you will still have access to the providers who care for you every day. So, you will see us releasing in the coming days more information about some of our offices that will be opening or closing as needed to again help make sure that we are supporting the government's efforts to take care of the sickest of the sick in our hospitals. As we do this, a couple of things I will reassure you about. Number one, you can continue to call your regular office for any care that you need. All of our providers and staff will continue to answer the same phones you always call. As you call, we will ask you some questions to make sure that we are setting up the right type of visit for you. Our goal is still to keep people at home and keeping with all the current government regulations to keep a safe distance and keep those of us who are not essential to the everyday work that's truly necessary right now in the safest place possible. So what that means is that you may not be offered a visit in our offices. If our providers and staff feel that you truly need to see a provider face-to-face so that he or she can perform a physical evaluation, an examination, or conduct other testing on site, we will make sure that happens. Otherwise, we will be offering our patients a variety of other ways to connect with their providers. You can still simply leave telephone messages for our providers and staff to respond to later, but you'll also be afforded in some cases the opportunity to speak with a provider via telephone and have your visit conducted that way, or even have your visit done face-to-face through a video tool like FaceTime, Skype, or Zoom. As we set up these other remote type of visits, we have also shut off access in the MyChart Epic application for you to schedule your own appointments. Please keep in mind the reason we've done this is to help ensure that you get the exact type of visit you need to take care of your issue. Normally we wouldn't be able to offer some of these services to our patients, but in this time of crisis, government regulations have been loosened to help us use some resources that we typically wouldn't. Also in this time of need, as we adjust what we do to help keep you safe and healthy, please keep in mind that we may not be able to schedule you a visit with your regular provider. Honestly, as my doctors, nurse practitioners, physician assistants, nurses, and other staff help prepare for this potential surge in hospitalized patients, we need to send some of them home to rest. So we will do our best to make sure that we schedule you with your regular provider whenever possible, but we'd ask your patience and flexibility if we do need to ask you to have a visit with a different provider. So again, to reiterate, as you need care, the care that you always obtain, please continue to contact your regular office. Our staff will continue to answer those phone lines and will set up for you the type of visit that best suits your needs. Those visits may be via telephone, face-to-face, or through a video interface, again, like FaceTime or Skype. Right? We look forward to continue to providing the absolute best care we can during this time of need, and I'll again thank you for your patience and understanding as we adjust to these increasing demands on our healthcare system. Thank you.